A warm welcome to everyone to this special session of the Global Health Policy Forum. It is our pleasure to have you either here physically or online joining us today. During the 2021 May Global Health Summit, President von der Leyen committed to relaunch the Global Health Policy Forum. And this followed consultation with civil society. This annual event will be followed by regular dialogue with civil society, policymakers, and other stakeholders in the global health arena.
We are Gabriela Fesus and Francisco Perez Cañado. We're the coordinators in the Commission's DG INPA and DG Sante of the work to shape the new EU's global health strategy. Together with several Commission colleagues present here today, we co-organize this forum with civil society organizations, and we are joined by prominent speakers and moderators and a diverse audience. You will be able to follow this forum in English and in French. If you are online, please select the French channel. If you are in the room and would wish to have the interpretation kit for French, raise your hand, and we will go to you in 1 second.
This session of the Global Health Policy Forum is special as it kicks off the stakeholder consultation on the new EU Global Health Strategy that the Commission will present before the end of this year. The Commission in the next days will launch an open public consultation, a call for evidence, and more targeted consultations as we have today with key stakeholders.
We look forward very much to listening to your views. This is your event. We're here to hear what you have to tell us, and all of your ideas will be fitting in the preparation of the strategy. Today, we're going to seek your views on two blocks of important topics. The first one, in the first session, will deal with priority setting for a strategy, how a strategy should look at global health architecture, and also about the effectiveness, how to make a strategy effective. The second session will be dealing with partnerships, genuine partnerships, and finance. The Commission's goal, this is an important point, is to present a communication on the new global health strategy by the end of this year.
To open this session, Commissioners Jutta Urpilainen and Commissioner Stella Kyriakides will share with you their thoughts. Let's watch it together.
Dear friends, this new Global Health Policy Forum would not be launched at a better time. The COVID-19 pandemic has destabilized the world at its core and deepened inequalities. It has also served as a wake-up call. Human development must be at the heart of our efforts for a sustainable future. The EU will invest more globally in education, health, nutrition than it has ever before. But we have to do so in a strategic and coordinated way. As part of the Global Gateway, we want to lead global action rooted in universal values of human rights, equality, solidarity, and cooperation. This is why we have decided to define together with Commissioner Kyriakides a new EU Global Health Strategy. A strategy that will help us to be better prepared. A strategy that will help us achieve the SDGs through stronger health systems, progress towards universal health coverage, and strategic partnerships that reinforce local and regional health manufacturing capacities for self-reliance and not dependence. Dear friends, civil society organizations have an important role to play in shaping and implementing this strategy and ensuring no one is left behind. Make your voice heard.
Dear friends, health challenges know no borders. Impactful changes in global health therefore require all countries to work together. In this spirit, we, together with Commissioner Urpilainen, have begun developing a new global health strategy. In a field with so many challenges, it is essential to define priorities, which range from drawing the lessons of the pandemic for health systems, defining health as a first line of defense against global threats, and delivering better health in a changing planet, linking it with other policy areas that deeply impact health outcomes, not least environmental policy. With these priorities, it will be key to bring a real change to people. We have shown EU leadership in global health during the pandemic. We will build on this as we craft a new strategy to adapt to and shape a changing world. As Team Europe, we must become even more impactful, speak with one voice, lead by example, and tie means to priorities to ensure results. We need to strengthen partnerships that help those most in need. We need to forge a multilateralism that delivers, and most of all, we need to hear from you. Today, we are eager to listen to all voices, from north and south, from east and west. And I'm sure your ideas today and throughout our extensive consultation process will be a powerful engine for the new EU Global Health Strategy.
Dear colleagues, today we have the immense privilege to welcome a distinguished guest for whom no introduction is required, Professor Piott. The fact that he joins us today not live here but on video, as he has tested, unfortunately, positive for COVID-19, is a very fitting metaphor, both for the immense challenges that global health faces today, but also for his tireless commitment to the cause that joins us all here, achieving real improvement of health for people across the world. He is an inexhaustible source of inspiration for all of us, because you will always find him in the different front lines of this battle, from grappling with Ebola in Yambuku to leading UNAIDS in Geneva, from mobilizing billions in the fight against infectious diseases to helping the EU face COVID-19 as EU Chief Scientific Advisor on Epidemics. Dearest Peter, welcome. This virtual floor is yours to share with us your reflections on the global health landscape and the challenges for our new EU Global Health Strategy. Peter, please.
Thank you, Paco, and thank you, Gabriela, and hello, everybody. And my apologies that I can't be with you in person. As Paco said, yesterday I tested positive, and that's why my voice is a bit different than normal. I certainly very much welcome the launch of the debate and the consultation that should lead to a strong and influential and adapted to the new environment of for global health strategy. As the Commissioner said, we need to be strategic because we want to make a difference. Now, we can, spend a lot of time trying to define what is global health, why does it matter for the world and for Europe, and it's interesting to see that global health, the term appeared only around the millennium, so it's hardly 20 years old, and it was born out of the AIDS movement while reflecting the understanding and of the connectiveness of health worldwide. And of course, the pandemic is a dramatic illustration of that, but it goes way beyond that. And as long as there are stark inequities in health, there won't be equal development, stability in the world. And that's one of the reasons that global health is now firmly part of the international political agenda, I should say, in addition to the health agenda. And before going into my reflections on what I hope should be in that strategy, or should be debated at least, we must recognize that there has been enormous progress in terms of health across the world. And thanks to the enormous efforts of communities, of countries, but also of the international, efforts, that's reflected in pretty crude indicators such as under 5 mortality, life expectancy, the decline in infectious diseases in many, many parts of the world, including in some of the poorest countries. But we also should recognize that major progress has been already reversed in some parts of the world, thanks to or due to the COVID epidemic, where immunizations have gone down, access to services and so on. But in addition, we have, of course, the impact of conflict, of war, the energy crisis, making it very expensive for most people, the climate change, and of course also the whole geopolitical environment, the pandemic. So let's recognize that. And as we all know, we're in a totally different environment, a different world than when we first had global health defined as part of the Millennium Development Goals, you remember, 22 years ago, and then the Sustainable Development Goals. It's a different world, including for global health. Geopolitically, and on the positive side, I would say there are new centers of excellence all around the world. This is no longer the monopoly of high-income Western countries and Japan, but particularly in Asia and Latin America, but increasingly also in Africa, we see centers of excellence. And it's certainly no longer a one-way street. Secondly, there is the accelerating impact of climate change, the loss of biodiversity, environmental degradation, issues around food security, and that will have a major impact on health. And we cannot just think in terms of biomedical interventions, because they may be wiped out by all these changes. And we should recognize that the SDGs are increasingly have been overtaken by events, and we need to reflect on that also. How relevant are they still? And then finally, as we also know, there's a change in the what? I mean, we are entering an age of pandemics. That's clear. We will have more of that, unfortunately. Non-communicable diseases are now the major killers in the world, with the exception of sub-Saharan Africa, but even they're on the rise, and we have a population that is living longer. I would argue that we also need a USP for a European strategy. How is it different, and should it be different? And I would argue that equity and respect for human rights should be at the heart of that strategy. While we, of course, need to be realistic in terms of Europe's interests and popular expectations in democracies with accountability. And also, let's not forget that Europe is a major hub of innovation and life sciences industry. We are the biggest exporter of vaccines at the moment. So how do I see the strategy? I always think in terms of the what and the how. And both are equally important. Because if the how is wrong, the what will not be implemented. And if the what is wrong, then the how doesn't matter really. And so the what is so important that we should also make sure that we must prioritize in order to have impact. This cannot be the encyclopedia of global health, which often is the case. And let me mention 5 issues that I think are the substantive priorities. First of all, I think that when it comes to global health, we should put health at the center, not only disease, with much more emphasis on prevention and public health, in addition to targeting major diseases, but no longer only infectious diseases. So health at the center, that means also people at the center. And instead of a chief medical officer, we should have a chief health scientist or officer, as, for example, Singapore has. Secondly, when we talk about priorities in terms of diseases, they should be tailored to countries' needs and burdens, rather than some often fairly abstract or theoretical global goals. Thirdly, strengthening health systems. Strengthening health systems, we've learned this the hard way. It's very difficult, and it's only through incremental progress, but it is a preamble for a sustainable way of global health. That is what happened in Europe, and that is what's happening in other places of the world in order to guarantee equitable health, better health. But it's not only about hospitals and healthcare, but we need to invest significantly more in public health systems and public health institutions, not only to deal with pandemics and pandemic preparedness, but these are essential also to keep people healthy throughout the life cycle. Fourth point, I would say, is of course epidemic preparedness and response. I won't go into details there, but that is now an essential part as well. And lastly, we are in a world of very rapid digital transition, which I think is an opportunity for many low-income countries to leapfrog development. We've seen it with the mobile phone, which is now so dominant, including in countries where, there are no landlines available for most people. So that's on the what. In terms, equally important, of the how, I would say we should have a radical redefinition and go for what we call One Health, or others call it a planetary health approach, where we bring human health, animal health, the environment, all together, because if we fail on one, the others will suffer. And that means also health in all policies. Secondly, partnerships are a key word here. The time is gone that somewhere in Brussels or Geneva or New York, we can, a bunch of experts decide what's good for others. We need these partnerships with those in need, including also in states in crisis where maybe the impact of and the return on investment may not be always obvious. It means that, a true partnership means also that we can learn from both sides. We can learn. Nobody is poor enough not to have very valuable experiences that can be useful everywhere else, and nobody is too rich not to learn from others. And I think the response to the epidemic is a case in point, where the wealthiest countries in the world have not always been the West that have responded most successfully. Thirdly, as Europe, we are committed to multilateralism, but a multilateralism that delivers and has to, to reform, to become more effective. Fourth, equitable access. That comes back to what I said as a core value, equitable access of services, of goods. And that means also, for example, distributed manufacturing, as we know, shift in power relations, assets and tools. And lastly, I would say the how. Let's not forget that research and innovation will remain necessary to learn while we're doing, and we need new tools. Now, as always, we have the what and the how. It helps credibility if we lead by example and if we do not harm, one of the basic principles in medicine. So we have to do what we preach, such as more comprehensive vaccination, stronger antimicrobial resistant action, a One Health approach in Europe itself. We're absolutely not there yet. Enhanced prevention, again, we're not there yet. And above all, increasing equity within our own borders. But let's also ensure that there is consistency in terms of policies and practice. One example that comes to my mind is human resources, as we call it, where we are recruiting actively in some countries healthcare workers from low-income countries, which are already struggling with a shortage of health workers. We need to recognize these internal inequalities and make sure that trade agreements and practices are not undermining global health. And finally, the process. And here I'd like to repeat that a key is going to be working in partnership across sectors. This is not only for the medical and health community. We have to consult extensively. Of course, we do it in Brussels, but that's not enough. We need to hear the voices of the people in partner countries, not just in Brussels. And what we hear may be a bit different. And engage with governments, with civil society, with business, and with non-state actors. And engage, I would say, selected EU delegations. Now, why would and should the EU Global Health Strategy work this time around? And I think there's a real chance, if we respect a few principles, and I hope you will discuss that as well at some point. First of all, of course, we need an implementation plan with budget once we have a strategy. A plan that is not only dealing with the financial assistance, but goes beyond that, in true partnerships on technical collaboration and cooperation and so on. And across the Commission and Team Europe, as Commissioner Kyriakides underlined. Secondly, ownership across all partners will be essential, not only within Europe, but with those with whom we work. If that ownership is not there, we will fail. Thirdly, it has to be part of the political agenda with accountability. And finally, I would say within the EU and the Commission and so on, I would argue that the ownership should go beyond international partnerships and health, which, of course, are the lead, but across the Commission. And my dream is that every EU ambassador in relevant countries is global health literate, and that there are dedicated staff, and that this is really a core element of whatever we do inside Europe and outside Europe. Thank you very much for listening, and good luck. I'm sorry my voice is fading away, and I may not be able to listen to everything for the rest of the meeting. Thank you.
So thank you very much, Peter, for this. Dear colleagues, we're moving straight up to session 1. Fantastic. Let me see if I can work the screen. Here we go. Which is the first session of consultation to hear your views, this time on priorities, global health architecture, and governance. I'm very pleased to co-chair the session with my civil society colleagues, Manon Kaiser and Margarita Leone. And as we have heard from the commissioners and Professor Piott, seldom has a strategy been more necessary than in global health. The breadth of our challenges requires the broadest consultation with stakeholders from the EU and across the world, not least the Global South. Throughout the pandemic, we've been working together with our member states and discussing a lot amongst us to provide a solid footing for the new strategy. And we would like to warmly thank the successive member state presidencies in the EU for their leadership. We'd also like to thank civil society organizations for the 2020 Shadow Strategy, Global Health Strategy, which is a vibrant source of inspiration. A year ago, we set the first building block of our new strategy, actually, as the Commission and Italy co-hosted the Global Health Summit in Rome, and G20 leaders committed to better prepare for future pandemics. Now, beyond pandemics work, we must move to achieve the wider goals of promoting and protecting health and combating health threats. As we discussed today, it is useful to recall that a strategy's goal is to define guidelines for action until 2030, identifying priorities, setting working methods, and mobilizing means. The strategy will then be, of course, developed through a number of concrete actions throughout this period. In this session, I'm going to suggest that you keep 3 things in mind as you tackle the 3 questions, which you can see on screen right now, and tell us your views. First, too many priorities means no priorities. Second, think broad about the new emerging global health order, covering not only its core, which is the WHO, G7 or G20, but also the interaction with the many initiatives, the myriad initiatives, and private actors that have emerged. And the third suggestion, if I may, is as you think about the role of the EU, the strategy should, I would even say must, encompass not only the EU institutions, but also our member states in this approach, in the joint approach that we call Team Europe. Over to my co-chairs.
So, dear colleagues and dear audience, my name is Margherita Leone from Save the Children, and this is my colleague Manon Kaiser from Global Health Advocates. We are pleased to be here today co-chairing the Global Health Policy Forum with the European Commission to discuss the future of global health. Sitting here today for us means shows strong commitment from the Commission, not only to build an ambitious and impactful strategy, but also to engage in continuous and meaningful dialogue with global health stakeholders to tackle emerging challenges in global health in the follow-up of the forum. As you know, civil society organizations have been following and advocating for the renewal of the global health strategy for quite some time now, and we have the impression that today marks the end of one process and the beginning of a new one. As Paco has already mentioned, this will not be a standalone opportunity to input in the global health strategy, and we encourage the Commission to include as many diverse voices as possible in this process. This is a period of opportunities that we must seize, as it has been recalled, the context has widely changed since 2010, the time of the last strategy, and we can now address what the previous communication could not or did not take into account.
Thanks. And although this event is kickstarting the consultation process, we're not starting from scratch. This is the result of the constant work that many stakeholders from all boards have conducted in the past years, and which have been setting up the building blocks for a renewed global health strategy. So to name a few, I'm referencing the Shadow Strategy published by several NGOs in July 2020, which Paco already mentioned, but also the Council conclusions adopted in December 2021 on strengthening a European health union, as well as the EU-AU Summit Declaration of last February, as well as many research papers and working group debates and exchanges that have been taking place in the last month. For example, the first ever joint conference of Foreign Affairs and Health Ministers that took place in February under the French presidency sent a strong message in favor of global health and dealing with it from a multi-sectoral perspective. And we know the strategy is a Commission-driven process, but we also call on Member States to engage in its development, especially since some national global health strategies are already being crafted. Considering that the added value of this Commission is the Team Europe approach, we strongly believe that these needs to be reflected in the priorities and the implementation of this global health strategy, where all stakeholders involved play their role to achieve concrete change. And finally, our goal as NGOs is to make the strategy efficient, concrete, and with sufficient funding attached. So in other words, that means an action plan, which will be implemented by Team Europe. Paco, over to you.
Thank you very much. Thank you very much. Time to introduce our moderator, Jennifer Brandt. Jen runs a consulting business in Geneva, where she has been working on global policy matters for just about 20 years. She started her career with Oxfam, working on the Make Trade Fair campaign. And today she works with the WHO, with WIPO, with NGOs, small, medium-sized enterprises, multinational companies, and others on issues related to international trade, innovation, global health, and connectivity. She has published extensively, and in recent years she has focused her substantial efforts on dismantling the gender gap in relation to intellectual property in particular. She is a Geneva member of the Gender Champions Network, and she mentors junior female professionals. Jen, all yours. Okay.
Thank you for that kind introduction, and thanks very much to Margarita and Manon also for co-hosting this session. So look, a lot has changed since 2010 when we had the last global health strategy come out. Clearly there's an increasingly complex landscape of health challenges that we're facing as the global health community. And the solutions that we're developing are increasingly complex as well. And this is really clear to me from my vantage point in Geneva, working on health innovation and tech transfer issues. If we look at things like digitization, connected medical devices, monoclonal antibodies, biologics, learning how to make biologics is a very long, stepwise process that requires partnership. And today we're still dealing with a global pandemic that required us to very rapidly expand global manufacturing capacity and to make vaccines at a scale never imagined by most private or public sector actors. And against this backdrop, what becomes obvious is that no one entity can do it alone, right? No one company or organization or think tank or NGO has all the answers. So partnership and collaboration, working side by side over many years, is essential. And we've heard this at the beginning of the session as well from the commissioners. And so in this spirit, we're here today to get your recommendations, insights, stories from all of the civil society representatives in this room, as well as online. And we'll be doing that in two ways, listening to your interventions and then also using Slido to run some surveys during the session to get some additional information from you. So let's do some housekeeping and then I'll hand over the mic so that you can start your interventions. To join us on Slido, we've got the instructions right here. It's quite easy. Slido is where we're going to be running the written part of the session. So if you have comments, if you'd like to submit written, input, etc., you can do that on this platform. You join by going to slido.com. Then you choose EDD22. You scroll down the list of events, and we are next to a little gray ball. It says Global Health Forum. You click on that, and you're inside, and you can start sharing what you want, etc. And we will be capturing what's written in Slido today for input for the commission. We're also using another platform, so it's a little bit of a hybrid. We've got Zoom, Slido, and also you in this room. It could get a little freewheeling. Bear with us. On Zoom, you need to get on Zoom if you'd like to speak. And there, we need you to click right on your name and very clearly name your organization so that we know who you are and we can call on you, please. So if you'd like to do that right now, that'd be great. So then we'll have Slido, Zoom, and when you intervene speaking, we're going to limit your time initially to 2 minutes, please, and we'll be quite strict about that to give time for people to, as many organizations, to intervene as possible. If we have extra time, of course, we can come back and have a more robust discussion, two-way discussion. So without further ado, if you can direct your comments to one of the three questions that Paco mentioned. We've got priority setting, global health architecture, and effectiveness. That would be great. Keep your input, short, concise. And we will start by, I understand we have Florian from Save the Children. We'll start by calling on Florian online to give a brief intervention. 2 minutes. Thanks.
Yes, hello, good afternoon, everyone, and thanks very much. I'm getting a strong echo at the moment. So the Commission's decision to renew its global health strategy comes at this really crucial moment, as we've just heard. I mean, COVID has really shown up the shortfalls that we have in health systems and services worldwide. And we're really at a crossroads, especially if you look at many low and middle income countries. They were not on track to achieve SDG 3 related to health, and delivering on SDG target 3.8 to achieve universal healthcare by 2030 was always very ambitious, and by now it really requests and requires an unprecedented effort. We believe that building strong, equitable and inclusive health system is really a precondition to improving access to good quality health services, to ending preventable deaths of newborn babies, and to improving pandemic preparedness and response globally. And we know that the COVID-19 pandemic has really hit children particularly hard. They suffer not only because of the shortfalls of essential health services, but also because of the crises that have affected education, social protection, and nutrition in particular. And therefore, the new EU Global Health Strategy should really put children at the center. It should target all aspects of children's lives, focusing in particular on the under fives. And the strategy should also ensure coherence between different EU policies which have an impact on health. For example, those related to climate, nutrition, trade, migration, and research and development. And in the long term, any health strategy has to prioritize the link between health and nutrition, because one can't be achieved without the other. So the EU strategy must address the fight against malnutrition, the access to affordable and nutritious food, and also the resilience of food systems. We see that right now more than ever, as we have really a global hunger crisis threatening large parts of Africa, the Middle East, and of Asia. And children are most affected by this, not only by hunger, but also by the spread of communicable disease, which puts an additional burden on many health systems that are already at the limit. So beyond acute crises, this strategy also has to keep the focus on the long term to really make it possible to achieve the SDGs by 2030. We think that by 2026, there should be a midterm review to see to what extent progress is being made. And we also think there should be a strong action plan to allow for monitoring and evaluation. No doubt the European Parliament has a really crucial role in that, and also in ensuring that the member states really feel a strong sense of ownership for the strategy and back it. And finally, the strategy has to come with the necessary funding in place to support its implementation. And this really raises the question whether the current EU budget, especially the Neighbourhood Development and International Cooperation Instrument, is fit for that purpose to really respond to increasing health needs globally. But I think you'll look at that a little bit later during the second panel. To conclude, we feel that the EU Global Health Strategy really represents an invaluable opportunity to allow the European Commission to reinforce its leading role in global health and to shape the future global health architecture. This should bring positive and long-term changes for the lives of millions of children. And please rest assured that Save the Children is committed to working with you to achieve the goals of the strategy. Thank you very much.
Okay, thank you, Florian, for that intervention. Before continuing with the interventions, I'd like to introduce a special guest, actually, and bring her to the stage. We have with us Shariatu Yolinde, who is a community health advocate from Benin. She is part of the EDD Special Young Leaders Program, which every year brings impactful young leaders from different parts of the world to the European Development Days. She's working on many issues for empowering women and girls, sexual and reproductive health, consumer welfare, food security. Please come to the mic, and we'd love to hear your insights. And I'll make an exception. I'll give you 3 minutes instead of 2.
Thank you so much. Good morning, everyone. It is a real pleasure for me to be here and to speak on behalf of my community. I will share my point of view about the priority in EU strategy health. As a young Beninese woman, 3 essential points should be included in the new EU strategy as priority. First of all, I will mention the promotion of reproductive health. It is true that many efforts are being made in this way, but we need to invest more in it to guarantee a better well-being for the mother, for the newborn, for the child, for the adolescent, and the youth. Secondly, we have the nutrition. This is a general problem of deficiency in children, while adults are exposed to several chronic diseases as obesity and cardiovascular disease related to the excess in the diet. So it is very important for us to find the balance and to devote more interest on this topic. And finally, we need more investment on the scientific research and the promotion of health. It's by this way, African especially will be able to produce the medical products for his own community. Thank you.
So I believe that we have an intervention from the audience. Elise from Global Health Advocates. Does somebody have the mic for Elise, please? And on Slido, just something to note, you're able to input questions, comments, whatever you would like to put in the Q&A section of our Slido event space. So please, if you like what you're hearing, if you have something to add, to ask, please feel free to comment in there. Over to you, Elise.
Hi, good morning. My name is Elise Rodriguez. I am the head of advocacy for Global Health Advocates. And thank you for offering us the opportunity to share our expectation for this strategy. At GHA, we believe that this strategy must be grounded both in a vision of equity, but also in a vision of fairness to address power imbalance as well as the paradigm that perpetuates systemic inequalities. As obvious as it may sound, we hope this strategy will seek to achieve positive impact beyond Europe's borders. And to support this vision, here are some suggested objectives and very concrete points, I hope so, for a greater contribution of the EU to global health. First, improving access and affordability to health services and products. We would like this strategy to set clear objectives to increase the coverage of people with quality health services and safe, affordable, and quality health products. Then this plan must reaffirm health as a public good and clarify how the EU will contribute to the effective management of global health threats by ensuring equitable access to medical countermeasures. One way to do it would be to attach access conditionalities and open science principles to EU funding for biomedical research and innovation, but we are eager to listen to other options today. Third, the pandemic has driven the desire for self-reliance of all regions, including EU and beyond. We believe the EU has a big role to play in building sustainable and self-reliant health systems in all countries. And as just said by Professor Piott few minutes ago, building public health capacities in partners countries should remain at the top of the agenda through greater financial support. Right now, the EU development programming is far from meeting this ambition, for instance, and through better policies, which brings me to my last point. We see as a priority the need to improve policy coherence across sectors and policies that can have an impact on health, like trade, climate, agriculture, digital, to name a few. Promoting global health can conflict with other policies and create tension. We know that. This may start by fostering coherent action across EU policies and define, why not, global health-related role and responsibility for each DGs. We are really much looking forward to continue this dialogue and to share our views with the Commission and with also EU member states. Thank you.
Thanks so much for that, Elise. So policy coherence and equity already coming out very strongly in the discussion. So we have another intervention from online. It's Piott from Oxfam International who's asked for the floor. And I think over to Piott on Zoom.
Thank you very much. I hope you can hear me well. Thank you for giving me the floor and putting together the valuable forum and starting the consultation process on the EU strategy. My name is Piotr Kolczyński. I'm a health policy advisor at Oxfam EU Advocacy Office. And my comments and the question are related to the EU ambition of improving a global health architecture, of building effective partnerships with developing countries. So one aspect of empowering these countries is increasing their research and development and manufacturing capacities to reduce their structural reliance on external aid. And we've seen how critical this is during the COVID-19 pandemic. Unfortunately, this aspect has been neglected by the EU in its vaccine strategy. And at the moment, only around 1% of all vaccines used in Africa are produced there. We hope that the recent EU pledges of investing over €1 billion in production and access to health technologies in Africa are a signal of a positive change in this regards. In today's short intervention, I'd like to focus on one aspect of this plan. So the relevance of increasing manufacturing capacities in developing countries will have very limited impact if control over the produced goods and the technology behind them will remain in Europe, will remain in the hands of pharmaceutical companies based in the EU. So improving developing countries' capacities must include enhancing research and development expertise and technology transfer so that these countries can produce and use these technologies as they need and can also adapt them for addressing future and existing other diseases. And seeing how protective the EU is of pharmaceutical companies' intellectual property rights, the last example of that we've seen during the TRIPS waiver negotiations, we are just concerned that this aspect can be omitted in the EU strategy. That's why we're making these comments, and we also like to hear from the EU if they also recognize the importance of technology transfer to go hand in hand with building manufacturing capacities, and what means which can allow for that are already considered to be included in this strategy. One of them, as mentioned by a colleague from Global Health Advocates a minute ago, is putting conditionalities in public funding or incentives for the industry that the technology developed through them with their help are accessible also for developing countries. So thank you very much for listening, for sharing your views also on this aspect, looking closer to it. And we as Oxfam, we are committed to getting involved in the development of the strategy and providing you with our expertise and opinion. Thank you very much.
Okay, thank you very much for that. And certainly a local manufacturing and R&D capacity can help countries not just adapt technologies from abroad, but also develop their own solutions to local or regional health problems that don't rise to the attention of global innovators, such as the big companies that you've mentioned. Thank you very much. So I think what we can do is launch our first Slido survey. This is going to be in the form of a word cloud. Antonia, if you could put that on the slide deck, we can introduce that. Okay. Have we launched our first Slido survey? It's in the section? Okay, perfect. So here we're looking for a 1 or 2 word answer, please. What's the most important priority area for the new global health strategy for your organization? And we're not just aiming to make something pretty. We're trying to actually see how many people ask for the same thing, et cetera. And we'll leave this open for about a minute, let you vote, and then we'll close it and continue with our interventions. We have a comment from the chat that's quite interesting that we thought we'd read out. We also need to talk about culture and values, not just technologies and health systems. For example, politicians in the Dash region still don't address some of the big killers: alcohol, smoking, sugar, lack of exercise, because these values constitute normal cultural life. As long as that remains the case, progress will be hard. So some food for thought there from the chat while we're populating our word cloud. Yeah, okay. So while the word cloud is being populated, I'd like to call on somebody from the audience here in the room. It's Josephine from the Africa Europe Foundation. If we have the mic for her, that'd be great. Thanks.
Thank you very much. So yeah, just very quickly, the Africa Europe Foundation brings together Africa and Europe in a more partnership approach, collaborative approach. And I think this is very much the heart of what I would like to ask and call for. It's making sure that this strategy is built in partnership. I know that Professor Piott was asking for this, and I call for it again. Africa has its own institutions. It has the Africa CDC, Center for Disease Control. It has the African Medicine Agency. They have their own priorities. They're setting them. We need to build our priorities building on their own. We cannot impose. We got to be collaborative. We have to understand what the priorities are for our partners and how we can contribute to them, how we can add our own stone to what's being built. So I think this is very much what I would like to add. I would like to also say, as Professor Piott was also saying, there are more and more centers of excellence that are being built in the Global South. We need to contribute to them, not just financially, but to tech transfer, knowledge transfer, expertise exchanges, etc. And I hope that this is also something that's considered when you create exchanges, not just in universities, but also to, for example, expert placements in manufacturing sites. There's definitely different exchanges that we can consider. So that's very much what I would call for. Let's not forget that our partners have their own priorities, and those priorities need to be taken into account from the start. Thank you.
Thanks so much for that. So we've got our word cloud populating. It looks like a very strong emphasis on strengthening health systems, even though everybody's writing it in a slightly different way. So we'll continue to let that populate, and then we'll close that, and we'll look at the results at the very end. I'd like to call on Blandine from Humanity and Inclusion, please.
Hello. Thank you for organizing this meeting first. Thank you very much. So I am Blandine Bougnol, the Deputy Director for Advocacy of Humanity and Inclusion, which is also called Handicap International. And I wanted to put forward a few points that we had prepared actually with also a group of NGOs, so I really much support what else was said before. One point is really about highlighting what Professor Piott was saying about having a people-centered strategy. So that means literally to put leave no one behind commitment at the core of the new strategy, which leads me to talk about the promotion of inclusive health. We have to make increased and specific efforts to reach out to the people who are disproportionately at higher health risks and death tolls, and that specifically, but not only, of course, target persons with disabilities. I just wanted to share with you the fact that persons with disabilities are 3 times more likely to be denied health care, and they face a 50% higher risk of running into catastrophic health costs in comparison to people without disabilities. Actually, the EU has taken commitments at the last Global Disability Summit in the sector of health, and we do hope that this will be reflected in the future EU Global Health Strategy. I wanted to make another point about the importance, of course, of focusing on strengthening public health systems, but strengthening it across the continuum of care. And that leads me to talk about the importance of addressing rehabilitation care. Not only we need to look at reducing mortality and morbidity, but also to look at how we could be increasing the world's population's needs in terms of daily functioning, participation, well-being, and quality of life. And that means investing in rehabilitation services. Today, 2.4 billion people globally need rehabilitation care. And this is going to grow because of chronic diseases, aging, injuries, and disabilities, etc. So take this into consideration. One last thing, because I know the time is short, I wanted to emphasize the aspect of the coherence that was mentioned several times. And the things that were maybe not mentioned until now, it's the coherence also with the new strategy on the European strategy, on the rights of persons with disabilities that was adopted last year. Also the strategy on gender equality and the rights of the child. Thank you, I stop there.
Okay, thanks very much for that. So we're monitoring Zoom, we're monitoring here, we've got Slido, and we've got some interesting questions coming in on Slido. One about financing. So just a note that will be addressed in the next session. There's a session after lunch that's complementary that looks at financing and how to make meaningful partnerships for execution of the global health strategy. And we've also got some comments coming in on health worker mobility and recruitment. and how that will factor into the strategy. So some topics that haven't been raised in the room yet. I'd like to call on someone from Zoom. We have Mr. Tom Rastow, who's working on mental health in Kenya, and I'd like to invite him to give his intervention on Zoom, please. No, he may no longer be there. Okay, no problem. We can certainly pivot and invite somebody in the room. Just one second. We have an interesting comment in the chat, but I'll read it after our next intervention. I'd like to call on Sophie from WaterAid, please, actually, since she's in the room.
Thank you very much. It's actually quite moving to be there, because I'm part of this group who was developing this shadow global health strategy some years ago. And frankly, if we had been told, we were really 2.5 years ago, we were really in the midst of trying to put together what we wanted from the EU on global health. And if we had been told, actually, you will be able to explain that to a whole room and the EU will be really on the point of developing such a strategy, we would have thought, okay, our advocacy work actually sometimes really works. And that's, thank you for that. That's really empowering to think, okay, actually I'm useful. So yeah, I am from WaterAid. I'm leading on our EU advocacy. And so for us, we are focusing on two main things on health. It's ensuring access to water, sanitation, and hygiene in healthcare facilities. Because right now, in least developed countries, it's only 1 out of 2 healthcare facilities which has access to wash. So I let you figure out what it means for a pregnant woman going to give birth in a maternity ward where there is just no clean water. And that's only one part of the problem. And then we also focus on access to hand hygiene in all places, so in households, in public spaces, in schools, etc. And so I have actually more a question than a comment, but it's, so I think we all agree that national health system strengthening seems really to be a key priority that has been mentioned many times, and it seems to be really coming back as one of the key priorities on which we all agree. So what does it mean for the global health strategy? So how the strategy will be able to really support the building blocks of national health systems, and also support the efforts of governments and NGOs, again, as part of health system strengthening to ensure access to wash in healthcare facilities. So that would be my main focus for now. Thank you very much.
Okay, thanks so much. We've captured that question, and we will add it to the record. We are recording, and we've got all of the comments on Slido captured here. So it looks like we have one person who is asking for the floor, Francesca from the Red Cross. So let's give her the floor, please. Francesca. You might be on mute. There we go. Oh, no, we can't hear you.
Like this. Can you hear me now?
There we go. Yes, we can hear you. Go ahead.
Perfect. Thank you very much. So, Francesca Ligi from the Red Cross office, and really thank you for this opportunity. We hope this is the first of other many opportunities to exchange on this topic that is really important for us. So I will mention 2 priorities in addition to what my colleagues say previously, and 2 possibilities for implementation, new way of implementation of this strategy. So the first, of course, is ensuring a fair development of high quality, but also accessible and financial sustainable local healthcare systems. But those local healthcare systems should be also aiming at better understanding how and why future health requirements are likely to change and be able to adapt to new challenges, also because this strategy is foreseen for a long-term period. We also would like to stress the point that of developing both community and capacity building in public health, reinforcing decentralized and local health structures to reach really the most marginalized communities. For this, it's also important to of course, ensure equitable access to essential healthcare services, including epidemiological surveillance, food and nutrition, communicable and non-communicable disease, sexual and reproductive health, and mental health, something that was not mentioned so far, or at least to my understanding. And for this, we think that it's important to keep the discussion around the universal health care going on, including access to maternal, neonatal, and child health, immunization, and psychosocial support. Just two food for thoughts for the implementation. We thought that we should aim at having innovation in health service delivery, particularly in areas where the health provision is lagging, hard to reach communities, leverage on the CSO knowledge of the local communities and capability to reach them. So this is one point. And another point is to accompany the global health strategy with strategies on community engagement and accountability to ensure communities empower and development, supporting those communities in influencing decision and policymakers. And so this will ensure a sustainable development and sustainable change in the health system. So we really welcome the initiative, and we're really looking forward to continue to work with you in the design and implementation of this strategy. And thank you again for giving me the floor.
Yeah. Thank you so much for that. We have an interesting comment that came in that I think I'll read from Margaret from the Leprosy Mission. She says, the point about continuum of care is very important. The UN Special Rapporteur on the Rights of Persons Affected by Leprosy yesterday highlighted at the UN Human Rights Council how a focus on cure and preventative chemotherapy has perhaps led to a neglect of complication management, physical rehabilitation, and mental well-being, among other aspects. So that just came in on Zoom, which please put that also in Slido. It would be nice because we're capturing the entire commentary on Slido. And we're seeing so many questions coming in on Slido, so feel free also to tell us your thoughts and your recommendations, but also to ask questions, of course. So I'd like to call on somebody in the room. Marie from the International Planned Parenthood Federation has indicated she'd like to speak. If we could pass her the mic, please. She's right here in the front. Thank you.
Thank you very much. Well, as the name of my organization says it all, we work on sexual and reproductive health and rights, and that's what I want to mention here. SRHR were not well included in the past global health strategy, which is one of the criticisms that was raised when it was published. At the same time, SRHR needs are really important across the globe. We've heard from our excellent youth leader, EDD, young leader, that SRHR are especially really important for young people in partner countries. So the needs are there. SRHR are critical to reach SDGs. It's part of SDG 3 on health, SDG 5 on gender equality, so we won't reach the SDGs without including SRHR in the new strategy. It's also important for UHC. It's a critical component of UHC. Once again, UHC can't be achieved without having SRHR there. It's also, it's really key to live healthy lives, to be able to participate in the lives of our community. It's key in all contexts. Babies don't stop to be born in war. They don't stop to be born in pandemics, so it's always there. We always need to take SRHR into account. And finally, I want to highlight the fact that the environment for SRHR is quite challenging at the moment. With the overturn of Roe versus Wade in the US, the backlash against women's rights, against SRHR, globally, including inside Europe, it's really, really important that the EU takes a strong stance for SRHR, includes it in the strategy, and continues to speak with a unified voice at whole level on SRHR, which means with partner countries during policy dialogues, which means in the UN, at the UN level, in the UN scene. This is extremely important, and as you will hear from grassroots CSOs when you will be consulting them in partner countries, this is really a key demand from them. So thank you very much for taking that into account.
Thanks so much for that intervention. Okay, things are starting to get more active on Slido and Zoom. So Zoom people, put your comments in Slido, and Slido, keep going. We're getting some really interesting commentary on there, and I'd like to encourage that to continue. We have an interesting comment that just came in, but first what I'll do is I'll launch the next Slido survey, and while you're filling that in, I'd like to read that out loud. It's quite compelling. So Antonio, why don't we launch the next Slido survey? This one will be a little bit different. You'll pick all but 2. So let's put the question up. Here we go. So these are basically, what do you prioritize most among these issues? You can pick 3, and 2 you leave off, and we'll do a ranking that way. Could you open that for me? Thanks. Oh.
Don't worry, I can give you the comments.
Okay. This is getting really free. We're using the cell phones. We've got Slido, Zoom. You guys are here. Multiple. Yeah. Oh, I wanted the one of the plan. Okay, that's okay. A lot of people are sending us good things in the chat. Okay, here's another one. So in terms of priority setting, one area should consist of addressing comprehensively and holistically the biggest killers. The main NCDs are defined by WHO and EC, such as cancer, respiratory diseases, diabetes, mental and neurological disorders. These are a leading cause of dailies and second leading causes of death globally. We need strong global and EU strategies and action plans addressing these areas and coordinated together. So another really interesting comment coming in on Slido as you guys are answering the survey. There was another one on this phone, but it's locked, sadly, so we'll get it back. Don't worry, it's coming. Okay, so we'll leave this open for a minute. You can work on that, but in the meantime, we'd love to call on Elena from the IOM to give an intervention on LinkedIn, and then we'll have a second LinkedIn intervention right after. So Elena, over to you.
Thank you very much. Can you hear me? Hello? Can you hear me? Hello? Can you hear me?
Yes, we can hear you. You're fine. Go ahead.
Thank you very much. Thank you for giving us the floor. I'm Elena Val. I speak on behalf of International Organization for Migration, Regional Office in Brussels. And we welcome this initiative and the engagement, especially of civil society and the European Commission, and the importance of having a European global health strategy. We call attention to the fact that on the 17th and the 20th of May, the first International Migration Review Forum took place at the United Nations headquarters in New York. Why it's important? Because this forum was the first occasion to review the Global Compact for Safe, Orderly and Regular Migration, the so-called GCM. One of the pledges of IOM during the GCM is to enable human mobility within resilient pandemic preparedness and response. What does this mean? It's that migrants will continue no matter what to be mobile and to be contributing to our societies, not only in through migration that it's south to north, which is what we perceive mostly here in the EU, but also to south migration. So there is also an horizontal migration. Migrants are important elements in our communities as they are workers, very often also health workers and caregivers. So we recommend indeed that migration is part of these global strategies, ensuring that migrants are included in the universal health coverage work, because there is no universal health coverage if migrants are left out of the equation. Also, we recommend strengthening health systems through indeed the migrant workforce and through tailored actions that include migrants in the pictures. So for all the member states across the planet, this is very important. And we welcome the efforts and also the mentioning of having the EU ambassadors health literates. We wish they are migrant health literates as well within this approach. And we appreciate the efforts that all the member states are doing to ensuring target not only 3.8 but other SDGs. Thank you very much.
Okay, thanks very much. We're going to do another Zoom intervention. If he's still there, Mugisha from Uganda, please. You may have lost this person. Okay, connection. Okay. Well, we'll go to Alieu from Liberia then, please. Go ahead, you have the floor, Alieu.
Okay, good morning, good afternoon, good evening to everyone. I am Alieu Musa Sharif from Liberia. I am glad to join the EU on this platform. It's great being here. So I want to appreciate you for this platform. It's a welcoming idea to put together something that will bring greater change to the world. So I want the EU to consider having the smaller groups, especially in Africa, because we understand that the COVID-19 has brought a lot of challenging situations in our continent, Africa. In a lot of African countries, particularly Liberia, we see a lot of people are getting afraid of getting the vaccine in most of the places we've observed. So I would love for EU to put emphasis on the SRHR training and empowering smaller groups in the community to engage a lot of groups in taking this vaccine serious. Another thing I would love for EU to include is the technology side, because we have a lot of smaller groups in most of the community. They are doing the work, carry on the awareness, but how can they get to international community with the information they've gathered? So it's difficult. So I would love for EU to empower the smaller groups so the work can be effective in our community. Thank you so much.
Thanks so much for that. Do we have anybody in the room who'd like to speak here? We're getting a little bit shy. Okay. I'm going to call on Hafi from online, and then, oh yeah, go ahead, madam. You're next, and then Hafi online will be after you from Uganda. Go ahead, you have the floor.
Sorry, let me just, okay, good. Thank you so much. My name is Jantine Jacobi. I'm representing UNAIDS at the EU, based here in Brussels, and thank you for the opportunity to intervene. And first of all, in case my previous boss, Dr. Peter Piott, is still listening, good health, and thank you so much for your wisdom and interventions. So I would like to start with some principles what we have learned from the AIDS response. First of all, like was mentioned by other partners, human rights is critical. It's critical for inclusivity and for people-centered approaches. Secondly, I would like to emphasize equity in access to health technologies. And from the AIDS response, we know what the human cost is if there is inequity, and we have seen it again with the COVID response. Thirdly, partnerships are critical, and in particular partnerships with communities, with civil society, because they help to have a tailored approach and make sure that there is inclusivity. Then gender equality. unfortunately a remaining issue that we need to respect, and in particular affecting those most vulnerable, such as girls and young women. The global solidarity is critical. We will talk about the health financing, but global solidarity, and it needs to be balanced by country ownership and leadership or the country priorities. And then lastly, the multi-sectoral partnerships. Now, I would like to quickly give some priorities. First of all, the health system strengthening to be grounded in universal health coverage and primary health care, noting that when universal health coverage was reintroduced, there were really concerns about exclusion of certain populations, in particular for prevention. So we need to make sure that marginalized population at risk of marginalization and exclusion are part of the system. Also, integrated people-centered approaches free of stigma and discrimination. And that could mean that we combine population-based approaches with programmatic approaches. For example, SRHR, HIV, focusing on those most excluded adolescent girls and young women. And it's noteworthy that in the context of One Health, the pandemic preparedness, most vulnerable populations are at the brunt of all these different interacting crises. And so we really need to pay attention. In terms of pandemic preparedness, we need to focus on current and future pandemics. We cannot let go the hard-won progress that we have made, and we know it too well from the AIDS response. Plus, the epidemics are not over. TB, HIV, malaria, we have 38 million people living with HIV. And then one last point, the implementation of the strategy needs to be informed by robust data. We need to know whether we are on the track or whether we need to adjust. And we can make use of existing systems, like for UNAIDS, we have the global AIDS monitoring. Others health disease problems have the same approaches, but there is the expertise that is available. Thank you so much.
Thank you. That's not the first time during this discussion we've heard about the need for accountability and metrics, so duly noted. I'd like to launch another Slido survey, which people can give their attention to while we are also calling on Hafi from Zoom. Let me introduce the question, and then we'll have Hafi intervene while people are also answering the Slido survey. So Antonia, if you could post that on here. See which one that is. And keep your comments coming on Slido. There's some really interesting stuff coming across. It's launched? Okay. Here we go. Okay. So here's another word. Name one other area apart from the strengthening of the international health regulations and the Pandemic Preparedness Treaty that you think where the WHO should be engaging to enact stronger rules. So one or two words is acceptable, and we'll create another word cloud, which is going to populate on the screen while we listen to Hafi from Uganda. Hafi, go ahead. Great.
Hello, I believe you're hearing me very well.
Sorry about that. You have the floor. We can hear you. Go ahead.
Okay, thank you very much. Thank you very much. My name is Mugisha Hafidhu, and I work with an organization called Why Not Uganda, or Youth Missed-Season Transition Uganda. We deal with youths and also go into healthy factors that are affecting these communities, because without a healthy community, you can't get healthy youth. So my point is very easy. As we are talking about the strategies and everything, I believe the key stakeholders in communities should be taken into considerations. For example, in Uganda, we have like the VHTs, the village healthy people. So we have to input the things, because if we speak about the global healthy thing, it means we have diversity or a variety of things. For example, you'll find the problems that are are faced in Dakar, Senegal, are not the healthy problems that you will find deep down in Uganda. And in Uganda, you will find different places with different problems. So I believe the inclusiveness of the key stakeholders, the key people who are in these communities, who are in these countries, who know very well the problems of these communities, I believe they should be brought on board so that they put in something accordingly. And then we come to a common goal, to a common problem or a common way to tackle these problems. I believe without sitting on the round tables and laying strategies, without coming down to do research, without bringing these people on board, I believe it's something that would be not good, or it would be taken not in bad faith, but these people will be left behind. And in the long run, you may find that the strategies are not working where we want them to be working. So in all, I believe it should be like that. And I thank you very much for the opportunity. That was my input regarding that.
Okay, thanks very much for that. Do we have anyone in the room who'd like to speak? Okay, great. Gentleman in the blue shirt, please. I'll get to you after.
Okay, thank you very much. I'm Omer Jaju from DAI, Tackling Deadly Disease in Africa program, technically for International Health Regulation and One Health. So I just want to talk to the EU and AU directly, straightforward for priority that they want. EU is a political organization, I think that, but they should more focus on policies. So priority should be on policies, supporting those government things to bring good policies on board. Research and training. We need to train people in the global south into, those people who are in service, those people who are already in training again, still students and other professionals. We need to do some kind of research and training and do translational research for all those things that we have. And those things that we already have, we should have equity in there. The best thing now that everybody recognizes is civil society organization. So we should make sure that those people are really on board. Most of the time, we go through the government, via the government, to work with the government, and then we think we are working with civil society organization, when actually we are just, building more inequities. So that's my short and little intervention. Thank you.
Okay, thanks so much. I had a gentleman in the back in the center who wanted to speak, and then next is Tom Rasto online. But first, sir, if somebody could give you the microphone, please, go ahead.
Thanks so much. My name is Iker Jimenez. I'm the Director General for Global Investment Agency at the Mexican Ministry of Foreign Affairs. Actually, I would like to make a short intervention about this. What we do here at Global Investment is all the work of attracting investment into Mexico and doing all the economic promotion of Mexico abroad. So also, during the last year, I was in charge of bringing all the COVID vaccines into Mexico. We made 200,000, 200 million actually, sorry, 200 million vaccines into Mexico. That was possible due to all the joint work that we made with many companies around the world, through our diplomatic offices around the globe. And also, it was possible with multilateralism. That was the key of bringing all those 200 million vaccines into Mexico. So it was a hard work, but we realized that we need to learn from that kind of work. And what are we doing right now? Because we developed so many capabilities about health in this Directorate General right now. And we've been transforming these capabilities. We are no longer bringing vaccines into Mexico right now, but what are we doing right now? What we are doing right now at this Mexican Ministry of Foreign Affairs is try to strengthen all the vaccines productions in Mexico. How are we doing that? One of the main projects that we have, it is with the European Commission right now, with DJ INPA, actually, and we're trying to create a joint work in order to strengthen all the capabilities in Mexico, but not only in Mexico. We're thinking about strengthening the whole region, Latin America, because we need to be prepared for the next emergency. We need to, of course, we need to get out of this one because it is not over yet. But what we're doing right now is to make a copy, maybe, of the value production of the production chain that we created between Mexico and Argentina to create the vaccine of AstraZeneca. We need to reproduce those kind of examples that we had in order to protect our region. Of course, we need to be aware that we need to protect our regions in order to be all protected. You know, we all say it all the time that we need to protect everyone in order to protect the whole world. We are really taking that in very, very seriously in Mexico and in Latin America for the next emergency. And finally, I believe that we have already mentioned very important challenges that we have. For example, talking about tech transfer, for example, about the collaboration with the industry, with the academy, with all the governments, with the society too. And also, we are working on this kind of collaboration in order to have this homologation of regulations in the whole regions. We have a sanitary regulator in Mexico that is level 4, that is a reference for a regional perspective, but we need more. We need those kind of efforts, of joint efforts in Latin America with the European Union help. I believe that we can be protected and be more able to react faster to the next pandemic. Thank you.
Is on tech transfer and manufacturing support.
Yes, for sure.
Got it. Loud and clear. Okay.
Thank you.
Thank you for that. We're going to transition to a Zoom intervention. Tom Rasto. I'd like to call on Tom Rasto, please. We lost before, but luckily he's back. So Tom, you have the floor. Thanks for joining us.
Thank you so much. My name is Tom Rasto. I am the head of programs and co-founder of Mental Health and Wellness Kenya. First of all, I want to thank you for this opportunity to give my intervention to the floor. So for me, I would say that the EU, hope I'm audible enough, right? Hello?
I can hear you.
Okay, I would like to say that the European Union, as said by my colleague, is a political organization that is really aiding Africans to be stable in one or the other. So in regard to today's area of discussion, we can say that
Rose. Ooh. Tom, we may have lost you. There he is.
From where I come from, Kenya.
Okay. Okay, if he comes back, we'll invite him back. Oh, there's Tom. Tom, try one time to continue. If we lose you again, we'll give a break. Or you can insert your comments on Slido in written form. Please go ahead. Please go ahead. We'll try one more time. No, shoot. Okay. Hey, Tom, I'm going to invite you to put your comments in Slido in writing because we keep losing you or we can't hear you. And we're missing half of what you're saying, unfortunately. Can you go on Slido or insert them in the Zoom and we'll transfer them? Thanks. So speaking of Slido, Antonia, I'm going to launch another Slido survey for us to work on while we call on someone in the room who's asked for the floor. If you could post that, that'd be great. Perfect. Okay. Slido's coming. This is another ranking exercise. So, oh no, this is disagree or agree. Okay, great. Should there be a more comprehensive mapping of financing by the EU and its member states? Yes or no? Do you care? Neutral, disagree, agree? While this is going on, I'm going to ask Eloise from Pandemic Action Network if she could take the floor, please. I know she'd like to make some remarks. Thanks. Over to you.
Thanks very much, and thanks for the opportunity. At the Pandemic Action Network, we're always trying to find more financing for pandemic prevention, preparedness, and response. But we feel passionately that these interventions and this money shouldn't always be raiding the health pot. Health ODA is very precious, and we need to protect it more and more. And the EU budget has always been an innovative beast, really, over the years. And if we think about the kind of things that started 20, 30 years ago with climate, what's the word I'm looking for? Impact assessments. We need to look at the resilience agenda and the sustainability agenda in terms of pandemics in the same way. We heard President von der Leyen say this morning that resilience and sustainability need to be at the heart of what we do. So I would encourage, as we look at what can we do with the global health strategy, this should not just be about, what are our priorities within health financing. This should be, how do we transform the entire EU budget so that resilience is at the heart of every single heading, that pandemic preparedness and prevention is at the heart of what we're spending from all of our DGs, because frankly, investing in that is much cheaper than the cost of the impact of a pandemic. So can the global health strategists inside the Commission also think very laterally about that, think about the midterm review of the MFF, the longer term review of the MFF, because we're just in this madness at the moment of all of the flexibility instruments, the cushions are used because of the terrible situation in Ukraine, other pressures. We've got to stop this kind of competition between what's the best health priorities for us to fund. We have to say all of them are important. Let's look at the resilience agenda and let's make sure every single part of the EU budget is contributing to that. And actually, done well, the EU budget can then set the standard for the member states and totally transform how we think about resilience funding. Thank you.
Thanks so much for that. We have one last Slido, so I'm going to launch that while we're continuing the interventions from the room, especially because I don't see anybody left online who'd like to talk at this time. Is there somebody in the room who would like to speak? Okay, go ahead. And then I'd like to maybe read one of these comments that came in, but after. Please go ahead. If we have time, we'll read.
Thank you. I would like to speak from Humanity and Inclusion. My name is Rita Crespo. About effectiveness and impact of this global health strategy. Effectiveness and impact can also be measured by the degree to which we will address and challenge power imbalances and underrepresentation in global health decision-making. I was just last week at the Conference of State Parties of the Convention on the Rights of Persons with Disabilities. And when speaking with organizations of persons with disabilities, in particular from Africa, the participation in decision-making in health is a huge concern for them. We believe in particular that we need to create partnerships with the Global South, but also in particular with users of underrepresented groups, with specific actions to enable their participation, ensuring their accessibility and reasonable accommodation so they are part of global health and decision-making. This will also require to address partnership and create this partnership not only in health, but also in other determinants of health, such as social, economic, and environmental determinants of health, taking a cross-sectoral and integrated approach. Thank you.
Thank you very much. The Slido is already going on. It's pretty self-explanatory. You have to pick 5 of these, 1, 2, 3, 4, 5, and leave 2. So if you don't mind participating in that while we continue with the last couple of interventions, that'd be great for us to get that information as well. Anybody else from the room who didn't get a chance to speak who'd like to say something? Oh, Kasia, somebody pass her the mic. Over to you.
Thank you very much. First thing I'd like to say is that I very much agree with the intervention of my colleague from IPPF about sexual and reproductive health and rights. So we know it's going to be a tough battle to fight in the Council, but we will fight it with you, so on that you can count on us, but it's important that it's duly reflected. My main point, and it's been mentioned in some of the interventions, is the role of communities. So we see that health system strengthening is really coming as a strong priority. But as we reflect on inclusive, people-centered, sustainable systems, we do need, I think, to give greater prominence to the role of community-led organizations in the new strategy. It hasn't been necessarily well reflected in the previous one, so there is room for improvement. I mean, this is something that is very obvious if you are part of the HIV movement, the role of communities in order to ensure that people from marginalized groups especially have access to services. So it remains extremely relevant today as it was 40 years ago. But if you look at the COVID-19 response, community-led organizations have been extremely important to ensure that people would continue having access to HIV services, but not only. They've also been critical in the rollout of COVID-19 campaigns, prevention tools, and so on and so forth. Awareness-raising campaign, all the information that was necessary, debunking misinformation, and so on. If you look at what's happening in Ukraine, again, communities are absolutely critical. Without them, the entire HIV and TB response would have collapsed. But we have to build on that lesson, to learn from that lesson in order to make greater space for community-led organizations in global health, across global health. And so what I would hope, and I will close on this, to see in the global health strategy is really to see the role of communities being championed by the European Union as part of resilient and sustainable health systems, because I think that this will allow us to really meet the kind of impact that we're looking for: sustainable impact, locally rooted impact, building on local expertise, and inclusive. Thank you very much.
Thanks so much for that. So going back to the PAN comment from Eloise on financing, please come back and participate in the second session, because that will be all about partnerships and financing. You'll see a robust discussion around all elements of the things you described. So I'm just going to do a quick recap of the key themes that I heard, and then we'd like to share the results of the Slido surveys with you. So the big themes that came out for me here are policy coherence as being really important, health in all policies, and especially attention to social, economic, and environmental determinants of health, inclusiveness, equity, the role of communities and health system strengthening being paramount, accountability and data collection and metrics was raised several times, and the importance of gender as well as health delivery across different contexts. So whether in a pandemic, whether in a war, et cetera, the importance of making sure that continuity is there. So we'd like to share with you the results of the Slido surveys that we did, and I'll ask my co-hosts, to give comments, anything that surprises them, that they find particularly compelling, interesting. I think we can put them maybe one by one on the slides, Antonia, if that's possible. Okay. So let's look at the first one, which I think was the word cloud. While we're waiting for that to come up, I'll read one last comment, which was general comment. This is a nice one. It's very positive to end on an optimistic note. A general comment of encouragement and priority setting. The Global Fund to Fight AIDS, Tuberculosis, and Malaria, the Global Fund, welcomes the review of the Global Health Strategy by the EU. This is very timely given the ongoing discussions on the overall global health architecture. The EU leadership will be crucial in the coming years if we want to continue tackling ongoing and new pandemics while ensuring equitable access to health for all. So it's like really a nice kind of concluding remark. So moving over to the word cloud. Paco, does anything jump out at you here? Any take-home lessons? Come on.
I think. Yes, I think that certainly at the center of the core of the discussion is a strengthening of health systems. I mean, I think that this is one that is that is absolutely, I think, a no-brainer. It's done in different ways, but I think at the same time, a number of the other issues are really focusing on the fact that we have to deliver real results for people on the ground. Whether you talk about universal health coverage, whether you talk about equity, there's a lot of things in that construct there. So I would see actually this as telling us those two stories. We need to look at strengthening health systems, but with a people-centered approach, and we should focus all our priorities on that, according to what we have heard today. And that's for me the one that stands out the most. Of course, there's many other priorities, and we will have to address all the challenges that we have in global health at any event. But I think that this is a very clear picture for us. So thanks very much for all those participating.
Great. Let's go to the next one, and I will ask you guys maybe to comment on this slide. So the priorities. So it's a clear winner.
Well, I think that strengthening health system is the winner of this session. But something that I wanted to add on what Paco was saying, I think that what it's really important that came out from a lot of the comments, it's the global sovereignty and the ownership of the strategy. We don't have to forget partnership. We don't have to impose from the top this strategy. We need to work with partners, and we need to work with partners in order to achieve long-lasting change. If we don't work together, this strategy will only remain on paper. And we don't want a new paper. We want an action, and we want change.
Absolutely. Oh,
and yes, maybe just to complete on what Margarita was saying about this idea of ownership and inclusiveness. We've had comments highlighting how it is important, and it ties very well to also the notion of tech and knowledge transfer that also came through, and that we saw on the work cloud previously, where these things don't go alone. They're not well, they're interdependent. You can't have one without the other, and this is something that we really need to ensure that this strategy doesn't miss this opportunity.
Mm-hmm.
Paco, you want to
Yeah. Yes. So no, I just wanted to give two brief comments there. First of all, one of the other messages I think resonated with all of us is that we have to ensure that we link health with all the policies that affect it. Yeah. And this, I think, came out from what many of you said. What I found a little bit surprising is to see at the end the One Health approach. Because apparently, that is less important to explore the linkages between climate change and the environment and its impact on health. For me personally, would be quite important. I am a little bit surprised that I saw it down there. No criticism, dear colleagues and friends. Just surprise.
Well, you only let them pick 3, so in all fairness. Okay, let's look at the next slide. Let's look at the next result. Okay, here's another word cloud. So is anything jumping out at any of you as surprising or unusual or unexpected?
Well, this is the word cloud about
WHO.
The WHO. Mm-hmm. And when I was looking at this, I actually wasn't reading what was there. I just was noting the many different areas where our respondents today believe the WHO can play a central role. And this underlines the importance of the institution to start with, and it underlines also the importance of pursuing those discussions that some of you have put on the table as to how can we make it in terms of accountability, in terms of governance, in terms of results, the kind of institution that we're looking for. And it is in that discussion, I think, where we're going to be finding ourselves also in the context of the strategy, because because multilateralism in our view is fundamental, and the WHO must be at its core.
This ties actually very well, this idea of so many sectors, with our question on global health architecture and assessing what is currently working and what is not and what can be improved. And I think these are all very good ideas of sectors that can and need to be strengthened. It also really echoes all what we have seen in the Slidos, in your comments and in your inputs. And yeah, I think that's really the main point of tying it together.
And here again, we see workforce management. Yeah. We see workforce management again, health worker mobility, which came up quite a bit in Slido as well, which is already actually an ongoing work program at WHO, but could be strengthened. Okay, let's see our next slide, our last one. Oh no, the second to last, yeah. Yeah, this one, okay, clear winner. So yes, map the financing of the EU and member states so we have more information about what's happening. Next slide. The last one, okay. Okay, so EU leading by example. Paco, any reaction to this?
Yes, I think that I think that question is very important, because if you want to be credible as a partner, you have to lead by example at home to start with. And I think that, to be frank with you, the responses don't totally surprise me, except for one, and that's to see digitalization at the bottom. Because this is digitalization will be potentially a fundamental enabler to deliver on our global health policy goals. Well, as I saw this, I was a little bit, shall we say, surprised again, no criticism, but obviously the fact that in the EU we have to focus on the kind of priorities that you have put at the top is very good information that we will certainly take back. Digitalization.
Comments? I actually agree with you. We were super surprised to have digitalization there, but I think that, I think that leading by example, definitely universal healthcare, universal access to healthcare, it's the most important thing. So I do agree with people that voted. It was one of my votes as well. So maybe a little bit biased. I was voting also from here, so maybe influencing a little bit the discussion. But yeah, I think that on digitalization, I do agree with you. This will be a strong enabler for the strategy, so maybe we should put a stronger focus on this also in the upcoming discussions of the strategy, for the development of the strategy.
Great. Okay, so we're going to close. We're going to close this session now. Unsurprising, number 2, availability of innovative health technologies. That was all the time. Don't despair, you have many chances to weigh in beyond today, lots of written evidence submission, et cetera, and we're going to put a slide and Paco's going to explain.
That's right. I was anxious for you guys to see this also at home. There's many ways for you to share with us your views. There's a very extensive public consultation we're holding until the end of September. There's a call for evidence, which is going to be coming up in the next couple of days, an open consultation as well. And there will be also many opportunities for targeted consultations, including with our CSO partners, so we can then delve in more detail the different important topics of the exercise. So thank you very much. And because I would get fired if I didn't say this, please, if you do plan to join us at the next session or the intersessional work for the Global Health Policy Forum, then you have to send us an email here. This has to do with data protection and all of that stuff that is so important, but we need you guys to contact us if you want to be invited again. Please please spam us with this. Yeah?
And thank you to everybody who joined on Zoom. Thank you very much for being part of this, even though it was a little bit difficult to engage like those in the room. So thanks very much. Bon appetit. It's time for lunch. And hope to see you again soon after lunch at the second panel, ideally, on financing and partnerships, because it sounds like there's a lot more of this conversation continue after lunch. So thanks.
People, sorry, just to say before all you go, just wanted to remind you that now we have a 1-hour lunch break and we wait for you at 2:50 sharp with our amazing colleague Brandon from One and other amazing panelists to talk about global health financing. Please come back and continue this discussion. Thank you.